Attending to patients with COVID looks and feels very different, right? 2.5 years ago, emergency rooms, hospital beds filled beyond capacity. Our healthcare workers were stretched very thin. And Dr. Calvin's son was among those working to save lives each and every day early on in the pandemic.
So the New York-based emergency physician and clinical assistant professor in emergency medicine chronicles his story and how he's healing in the new book, The Monsoon Diaries. So Dr. Sun joins us now this morning. Thanks for being with us.
Thanks for having me. It's good to be here. Pub Day is today.
There you go.
Congratulations to you. Listen, I was reading a little bit about your background. You've had an amazing life. You've been traveled all over the world, have had many adventures, but perhaps your most trying adventure was right here in New York City during the pandemic. And then you write this book. Why write this book? And why did you choose the title, The Monsoon Diaries?
I mean, COVID was the adventure I did not sign up for.
Yeah.
And a lot of people were wondering as I was presenting how COVID unfolded that March and April of 2020, how it got to that point to be so prepared for it. And the answer was we were all making it up as we were going along. It was a moving target. And after it calmed down and after a lot of us got vaccinated and we had a time to take a breath early last year, I was approached by multiple people to write this book. In the literary world of this nebulous world of publishing industry got me, to go with the flow, and here we are on Pub Day. And I'm only just so grateful to be able to share the writings I was doing at the time.
Yeah. Because
I was a travel blogger, and then I was in a time where I couldn't travel, so I just kept writing, and now here we are.
Right. I mean, you call yourself the Monsooners, right? There's a bunch of writers.
Called it that. Yeah. So I'm like a modern day Forrest Gump. I was traveling alone for the 10, 12 years ago, and then people started showing up in airports, and I'm like, who are you?
Right.
And then they're like, I want to come join you.
Right.
Yeah, and then they started calling themselves Monsooners because we combined spontaneity and adventure without having to give up your day job, because I was a full-time medical student.
Well, yeah, and you worked per diem at multiple hospitals during the worst waves of the pandemic in New York City, right? So take us back to the day that you actually treated your very first case of COVID. What did you know? Were you worried at all? What was it like? Take us in the room.
It was surreal. It was the stuff of nightmares. I had literally returned from a trip that I was co-leading in Angola, where there were signs everywhere about COVID and coronavirus. And literally March 7th, I returned to Newark Liberty International Airport, and welcome home was the only sign I saw. And I'm like, Angola was more prepared. And then 12 hours later, 8 a.m., my first COVID patient. Didn't have symptoms, but looking for a test that we didn't have. That was already a nightmarish, because I was like, you're about to catch COVID by coming here for a test that you didn't want. You're about to leave with a party favor you didn't ask for. And then I just saw like how the future was unfolding before my very eyes. With week after week, it would just get worse and worse. I mean, I looked like Darth Vader. I'm looking for PPE that didn't exist. Seeing patients, I wrote a story in my book, patients hoarding our PPE that we couldn't do anything about. We wanted to give it to them, but we didn't have enough for ourselves. It was a rough, very weird time. And I collected all these stories, and eventually, we collated into this book.
Wow. When you're looking around you and you see patients dying, even your own colleagues dying, how did you stay motivated to stay in this and to keep on treating patients in this scary environment?
That scene from Black Hawk Down when someone gets shot in the turret and then there's like a pause and everyone's like, who wants to take their place? Like, that was my phone. I was constantly called to take up different doctors' shifts because they were getting sick with this unknown virus. They didn't know then when they were going to be back because we didn't know anything about it at the time. And because I was per diem in multiple different hospitals, I was credentialed and I was able to go to different hospitals at the time. And I knew if I didn't show up, if I took the day off, which I could have because I was in control of my schedule, which I thought I was going to do. I'll give myself a few days off so I don't want to bring this virus home so I can get back on my feet. I ended up going every day. I think I worked 35 shifts the first month and a half because I knew if I didn't show up, who was going to take that place? Emergency rooms would have curtailed its ability to take more patients, maybe it would have shut down, and that was the beginning of the slippery slope of I think almost collapse of our medical system.
Well, yeah.
We had to go in.
Yeah, well, and people always say the medical field is a calling, right? And that you answered that call each and every single day. And you said you could have taken the day off to prevent it from getting back home, but it did hit your home in a very unique way. Your grandfather was among the people who actually lost their life during the pandemic, right, due to COVID-19. How did that affect you, personally? You're dealing with this tragedy, and then your willingness to still go to work and help others.
As I go back and forth in the book between, the loss of my father. So the book is not just about COVID. COVID is like a vehicle to tell a story about overcoming grief, loss. So I used my father's death when I was a young kid, sudden death, didn't expect that to happen, as well as not expecting to travel. That was totally out of the blue. And then when my grandfather died, I was in the middle of a pandemic. And the book is about facing the unknown and how I prepared myself to get there. And even when, as much as prepared as I was, he died literally at the moment I thought, well, it's April now. I'm still alive. I'm so grateful. Maybe I can get over this. Maybe there is a light at the end of the tunnel after 6 weeks of dealing with this every day on the front lines. And then I get the phone call that my colleague in another hospital I work with says, your grandfather is here.
Oh my gosh.
And he's saying that he knows you and, you know, we're going to take care of him. And I told her, I was just like, I told him not to go. I was going to go over with the pulse ox and monitor him because I didn't want him to catch more COVID in the viral load of an emergency room that was packed in Elmhurst Hospital. That's where he was, the epicenter of epicenters of epicenters. And I just saw the slow decline, and he represented all the patients I took care of. And I'm like, it's not why me, why me, why me, why not me? I was part of it with everyone else.
Yeah, we've run out of time, but I just want to quickly ask you, Dr. Sun, what's your biggest takeaway then from all of this?
That COVID, loss of someone, anything that we go through in life, these are discrete things that happen that we think that will never change. And we try to move on. You know, right now we're trying to move on. But you have to honor the process. You have to go through the process of grief in order to adequately move on. And I realized these things will never leave us. My father's death, my grandfather's death, COVID, the pandemic, that's something we all share together as collective trauma. But our attitudes to those things can change. And that's what defines a person. And writing this book allowed me to see that COVID will not control us. We can control it. And maybe the reader from this book can also use that as an opportunity, such as a pandemic that we all shared, to reframe and relook at our lives with more clarity and purpose.
Amen to that.
Well, I'm looking forward to reading your book, Dr. Sun, and we want to thank you again for being with us today and for everything you do on a daily basis, taking care of the people here in New York.
By the way, you can thank him in person. He'll be giving a talk and signing copies of his book, The Monsoon Diaries, on Thursday from 5:30 to 6:30 p.m. at the Columbia University Bookstore. Dr. Calvin, thank you, Dr. Calvin Sun. Thank you. Seriously, thank you for everything. It wasn't just enough that people clapped and applauded at 7 p.m. every night. Thank you for what you do each and every single day.
Dan and Hazel, thank you very much. Pay off my student loans. That's the
There you go, right?
There you
Good
go.
luck. Good luck with the book.
Still paying those off.